All right, today we're going to do a supplement for our shoulder exam lab. This is David Harmio, and he's going to be my patient today. Do you consent to using this video for educational purposes?
Yes.
Sweet. Okay, first we're going to start with a physical examination, inspection of his general posture and body structure. So go ahead and stand up for me. And I want you to look straight up. And then straight down towards your chest. Look towards your shoulder. Back up. Look at your other shoulder. Now look ear to shoulder. Good. And then ear to your other shoulder. Good. And go ahead and relax. I'm going to push down on your head. No pain? Good. Okay, looking good. All right, we're going to start with some palpation for his general structures here. So go ahead and relax a little bit. Right here we have the jugular notch, and then we have the shaft of the clavicle coming along to the AC joint here, bicep tendon down here, and we can feel the head of the humerus here. And then running back, we can feel the top arch of the scapula. And then going down, you can feel the medial and inferior borders of the scapula. All right, so I'll have you go ahead and stand up for me and face that way. I'm just going to inspect that your shoulders are the same height, which they are. And I'm also looking for your scapulas to be throughout the same position, which they are. Okay, good. Okay, next we're going to start with some range of motion activities. So first I'm going to have you bring your arms straight out in front of you as high as you can. And I'm looking to see if the scapulas stay in a neutral position or how they move and if they're equal. Go ahead and go down. And now you're going to bring your arms straight out to the sides. And straight down. Good. Next we're going to test for internal rotation. So bring your arms to 90-90 and rotate your arms down and in. Good. And then next we're going to bring our arms straight back. Good. Good range of motion. For the next shoulder range of motion, I'm going to have you bring your arms straight up and then try and reach behind your back with both hands. Generally, the dominant arm will reach not quite as far as the non-dominant arm, but yours look pretty equal, which is good. And now I'm going to have you internally rotate and go up, so just going from behind your back and up. Good. Looking good. Okay. Okay, next we're going to move on to some strength testing, some manual muscle testing. So first we're going to test the deltoid. So go ahead and try and bring your arm straight up for me. Good. We'll do the other arm. Feels nice and equal. Good. Next we're going to test for the biceps. We normally test this one with the shoulder girdle because the bicep tendon attaches to that general region. So I'm going to go ahead and support your arm here. And I want you to try and curl up against my hand. Good. Do the other side. Good. Nice and equal. Okay, next we're going to test your triceps. So this time you're going to push against my arm, going downward. Good. Go ahead. Good. Okay, we're also going to test some of our nerve roots down in the hand. So I want you to make a fist, and I'll have you go this way. I want you to try and pull up against my hand. Good, and we'll do the other hand. And pull up, good. Now make your hand straight out like this. I want you to push up against my hand. And push straight up against my hand. And this is just testing some more of the different nerve roots in that general region. All right, next we're going to test muscles for the supraspinatus. So bring your arms straight out, and we're going to go kind of at an angle here. I want you to push up against my hand. Good. And And go ahead. Good. Okay, next we're going to test for some internal and external rotation muscle. So go ahead and bring your arms to 90-90. And I want you to resist my hands and go outward. Good. And now I want you to go inward. Good. Another way we can test the internal rotation is by having you bring your arms straight behind you like this, against your back. What I want you to do is bring your hand off your back like this. And push against my hand. Good. Then we'll do the other hand. Good. Okay, next we're going to move on to some special tests. So go ahead and bring your arms straight out in front of you and then thumbs pointed down. And I want you to bring them straight up above your head. Is there any pain with that motion?
No.
And your scapulas look nice and neutral, so go ahead and go back down. Good. Okay, next we're going to do the Hawkins test, which is an impingement test. So go ahead and bring your arms straight up like this. I'm just going to move your arm in and out. Any pain with that? Okay, we're going to test the other side. No pain? Good. All right, next we're going to test for impingement on the AC joint. So I'm just going to have you cross your arm across and then kind of make a scarf. It's also called the scarf sign. No pain? Good, and we'll go the other way. Good. All right, next we're going to do something that we call a apprehension test and also a relocation. So go ahead and bring your arm 90 degrees, and I'm going to have you externally rotate. Any pain with that? No? Now, if he had dislocated the shoulder in the past, sometimes the person would feel pain with this motion, and by putting my hand here supporting it and go ahead and externally rotate, this should relieve the pain. And then when I take my hand off, then the pain should return, and that would be a positive apprehension test. And we'll go ahead and test the other side, just to keep it nice and even. No pain? Good. Okay, next we're going to do some testing for shoulder laxity. So to do this, I'll have you turn a little bit so we can see the camera. And I'm going to put my forearm on his back and grab his shoulder. And I'm going to move his shoulder forward and back. Generally, to get a good indicator, you'd have to test both shoulders, so I'll go ahead and do that. His shoulders are about the same as far as laxity goes. We're also going to test for something that we call the sulcus sign, so I'll have to turn again. So same position setting up. And we're just going to pull straight down. And he doesn't have one, but if he did have the sulcus sign, there'd be a little indentation right here. Okay, next we're going to test for some labrum, the issues with the labrum. So I'll have you bring your arms straight out, about 10 degrees this way, and then point your thumb down. And I'm going to have you push up. Is there any pain?
No.
Okay. If there was pain in the AC joint, then it'd just be the AC joint. The labrum wouldn't be involved. If there was pain deep in the shoulder, then more than likely the labrum is involved. And if there was pain with this position, with thumb straight down, we would have them bring their arm straight out again, and we'll have them supinate their hand upward, and I'll have you push up again. If there was less pain, you can relax. If there was less pain in this position, then it'd be a positive O'Brien's test. So I'll test both sides for this. Thumb straight down, pushing up, good, no pain. I'll have you flip your hand, no pain. For David, it wouldn't matter because he doesn't have any issues with his labrum, but that's generally how you would test for the O'Brien. All right, next we're gonna do another test for the labrum. So I'm gonna have you bring your arm about 90 degrees, and I'm gonna push inward towards your shoulder, and internally and externally rotate your hand. Any pain with this? Good. And that would be the crank test. And similarly, we do what we call a clunk test. So I'm going to do the same thing, but from the anterior position. Any pain with that? Good. And this would indicate a posterior labral tear. So now we'll go and test the other shoulder for the same things. No issues there. Good. All right, next we're going to perform what we call the speeds test. So I'm going to have you bring your hand straight out and then rotate it to the side a little bit. And I'm going to have you push up against my hand. Good. We'll do the other side. This is a test for the biceps, but it also could be an indicator of labrum issues. Okay, next we're going to test something that we call the Jurgensen's test. So I'm going to have you bring your arm to about 90 degrees, and you're going to try and supinate or bring your palm up against resistance. Go ahead and go. Good. This also tests for biceps, but again, can also indicate problems with the labrum. Good. All right, next we're going to make sure that the cervical spine is not also involved with our shoulder pain. So what I'm going to have you do is tuck your chin into your neck and then look up towards the ceiling at an opposite direction. Good. And I'm going to push down towards on the top of your head. And is there any pain with this?
No.
Okay, and we'll do the other side. Good. And this is testing for impingement of the nerve roots in those foramina in that area. All right, that concludes our shoulder exam lab. Thank you for your participation. We're all done for today.